All right, let's go live now to Jerusalem, where I'm joined by Dominic Allen, the UN Population Fund's representative for the state of Palestine. Thank you so much for being here with us. So we just heard there are 50,000 pregnant women in Gaza. I mean, many of those will be in the north who have been told now to evacuate south. What kind of dangers are they facing on that journey, those who can move, and what are you hearing?
Well, thank you. It's been a horrifying week. The unfolding humanitarian crisis in Gaza is catastrophic. And as you noted, there are over 1 million women and girls in Gaza. And UNFPA and I am extremely concerned for Gazans 50,000 pregnant women who right now cannot access the basic maternal health services they need. They're facing a double nightmare. And as you referenced, the healthcare system itself in Gaza is crippled. It's under attack and on the brink of collapse. And these pregnant women that we are seriously concerned about have nowhere to go. They're facing unthinkable challenges.
Yeah, let's talk about those challenges. I mean, even if you put aside the danger from bombing, which is still huge. I mean, the lack of food, water, electricity when you're pregnant. I mean, what kind of threat does that pose to their health and their unborn child?
Well, exactly. And of these 50,000 women, we expect that 5,000 of these will give birth in the coming month. So imagine having been displaced from your homes, fearing for your life in shelters right now with very little food, very little water, very little fuel, and with little access to the healthcare they need. Some of these pregnant women may suffer complications. They will anticipate to do so. So whilst 8 days ago, they would be thinking of the dream that they would be fulfilling, this life-affirming process of giving birth. But right now, in the shelters they're in, they're not able to access the healthcare that they need. And we're hearing from the hospital staff, the midwives on the ground, telling us some very harrowing stories.
Yeah, well, can you share any of those stories for us? What are you hearing from them?
Yeah, we from UNFPA, we spoke to a midwife at the El Shifa Maternity Hospital, one of the biggest facilities for giving birth in Gaza. And they're reporting that since the start of the escalation, as a midwife themselves, they've been separated from their families, unable to support the pregnant women that are there. And many of them are unable to even get to the maternity wards because of the unsafe environment. So they're fearful in their homes. And imagine going through that process in those final stages in your last trimester before giving birth, with possible complications, without clothing, without hygiene support, and not sure about what the next day, next hour, next minute will bring for themselves and for their unborn child.
Yeah, I mean, it's just horrific. I mean, many parents know all too well when a baby is born, even in the most, prosperous nation with the best medical care around, life is so precarious. I mean, it's tragic to think how many newborns won't have a chance at life because of this war.
Absolutely. I mean, this is why we from UNFPA echo the Secretary General's call that even wars have rules, that these civilians, these health facilities, these pregnant women must not be a target. And we call for their protection. The violence must end, the siege must end, and humanitarian aid, which is unable to get through, has to get through to support all Gazans, and for us, primarily, those pregnant women who are in need of medical care and in need of those health supplies.
All right, so those supplies, I mean, they exist. The resources are there, but I understand you can't get that help to those who need it. I mean, what more can be done here to help those pregnant women and new mothers?
Well, the first thing, as you said, there is a siege at the moment. So humanitarian aid and supplies to Gaza must be allowed through. There must be a humanitarian corridor opened and humanitarian law abided by. The pregnant women must therefore get access to those life-saving health services. So we want safe humanitarian access immediately, and humanitarians and healthcare workers must be able to reach those pregnant women and all of those in need of those life-saving supplies and services.
All right, let's hope that does happen. Thank you so much for speaking with us, Dominic Allen. I appreciate it.
Thanks.